Welcome to Corruption Chronicles. I'm Debbie Peterson, your host tonight, and we're going to be discussing fertility care corruption. Tonight's guest, Dr. Yemi Famuyiwa, is the author of The Quest for Fertility, a science-guided path to reproductive and lifelong health. She is a board-certified reproductive endocrinologist and infertility specialist. She is the founder and medical director of the Montgomery Fertility Center in Maryland and the assistant professor of obstetrics and gynecology at the George Washington University School of Medicine. Dr. Yemi is the host of the Fertile Talks podcast, and she has a lot of awards and recognition. The Castle Connolly Top Doctor, Face of Fertility in the Washingtonian Magazine, Women Who Move Maryland in the Baltimore Magazine. So you may ask, well, what are you talking about? Where is the corruption in fertility care? And Dr. Yemi will tell us that it's in the structural consolidation that's occurring within fertility benefits in the United States. In many cases, the same corporation designs the insurance plan, operates the pharmacy benefit, and owns the pharmacy that's dispensing the fertility medications. So I'm not going to say anything more about this, except Dr. Yemi, welcome. And mostly in business, we think vertical integration can be a good thing. So what's the problem with vertical integration in fertility care?
The problem with vertical integration is that there is not a lot of price transparency. It leaves patients totally confused, and oftentimes the doctors, the service providers are caught in between because the patients believe that it's coming from the physicians and they just don't know the hoops that they have to go through. It's extremely complicated, and it's the rare patient that completely understands their plans.
So it's not really the doctor in charge, it's the insurance
Oh,
companies in
no.
charge.
Yes, patients will say, I need to know how much I need to spend, say, on medication. And they expect you to give them a very precise answer. The real answer is, I don't know. Because it used to be in the past that you had insurance, then you had the pharmacy, the doctor writes a prescription, go to the pharmacy, you pick up your medication. The pharmacy buys the medication from pharmaceutical companies. They sell it. Well, many years ago, they decided that we want to reduce costs, or the insurance plans decide that certain medications are too expensive. So it needs oversight. So they created something called pharmacy benefit companies. And what that is your middleman. The insurance company may say, well, the middleman, can you help us negotiate the best price for this medication that we want to cover? The middleman also goes to the manufacturer and says, if you produce X bucket of medication, can we get a discount, or can we get a group purchase? Then the same middleman can also decide which pharmacies can buy it. So far, so good. But when you get consolidation, all of a sudden, the middleman is now actually owned by the insurance. And sometimes they may decide, you know what, we can make more money if we actually also sell the medications ourselves. So all of a sudden, now they're dispensing. Or they could go to a specific group of pharmacies and say, we'll let you be the pharmacist of record for this medication if you agree to do whatever it is they want you to do. That cuts out competition in a way. So you would think that it would result in lower prices, and it doesn't always.
The insurance companies are middlemen too, frankly, because people can't just go to a doctor and pay their doctor.
Exactly.
And so there's an insurance man in the middle who's
Right.
making a profit and bumping the prices up and
Exactly.
controlling what's available to people, controlling their health, even though they're not health experts. And then when they do this vertical integration, you get more middlemen because you get the middlemen buying the medications rather than just going straight to a pharmacy to buy them straight from somebody.
Right. And they also decide, well, how are you going to bill for this? Everything you bill for in the pharmacy world or in the medical world, everything has a unique code, right? So most patients don't know that. It's a unique code. So for you to get your services, you have to punch in that code. Then the insurance can decide that code is covered, that code is not covered. Now, I don't always blame them because some of the things they can do is when they sell packages to employers, so they're going to sell an insurance package to a company, they may decide that your employer may say, well, we can't always afford this. Therefore, can you take this out and take this out? So you take it piecemeal. You have a lot of confusion between the insurance company as well as not just the insurance company, but also manufacturers that produce the medication itself. So that's where the problem could be.
What about the insurance reimbursement then? Does that become an issue? Is that working fairly?
The insurance reimbursement varies greatly. Sometimes it's so confusing. The insurance coverage reimbursement, they decide how much they're going to reimburse for certain things. So they're going to say, well, we want to reimburse a particular service. We're going to determine not just the code that's covered, we're going to determine which codes we're going to cover. Not only that, we're going to determine how much we're going to pay for it. So the problem becomes, and this happened over the years. I'll give you an example. I don't do GYN care, but to give you an example, let's say an older person decides they need a pessary because they have incontinence and they wear a pessary that prevents them from having surgery. If you have to replace the pessary, you have to buy it. But Medicaid or whatever insurance company decides that they're only going to give you X amount of dollars for this product. Let's say the pessary costs the doctor, or it costs an actuality, and I'm giving generic numbers. Let's say it costs $50, the cost of the pessary itself. The insurance can say you're not allowed to sell it to the patient. So you have to buy it. You have to buy the pessary, but assuming the cost of it is much higher than it actually costs. So if it costs the doctor $50, but you tell the doctor, I'm only going to give you $30. Well, guess what's going to happen? The doctor is just not going to provide their service. It's going to say, forget it. I'm just not going to give that services anymore. So that's where the difficulty comes in those cases. They have the power to determine how much they want to reimburse. So if it doesn't cover what the actual cost is, then for that particular service, the physician is simply not going to offer it because they're going to offer it at a negative. It spirals downward after a while.
Is there some way to fix that? Do you have any suggestions? Is there anybody who's to get around it, or?
I think I don't have a quite solution other than say that if we could expose these problems, because all these things ultimately make medical care more expensive. For instance, I do IVF, right? We all know the medication for IVF are so expensive for whatever reason. Now you cross over into Europe or Asia, the same medications are a tenth of the price. Also, when I went a conference in London just a few weeks ago, I used to believe that these medications had no generic equivalent because we didn't have it in the US. And then I go there and lo and behold, I saw a generic version of the same thing for a fraction of the cost. And so I asked them, are you going to at least try to apply through FDA so we can get this medication available? And my impression was it was going to be too much of a headache, so they're not going to do it. It used to be in the past that some patients could order some medications from overseas. Well, that's been shut down. Now, I must say though, to the government's credit, I think they saw this themselves. So they forced these companies to say, listen, it doesn't make sense why you're selling this medication, and I give you a generic number. Let's say you're selling the medication for $100 here, but we step over to Europe and the same medication is $5. So if you don't give us a break, if you don't lower the price here, we're just going to tell you you can't do business anymore. So that forced these companies to lower the price, and they call it that you can get a coupon code or something. It forced these companies to lower the price of some medications here. The person that pays the most for it is the person that doesn't have benefit coverage to buy the medication because everything is so expensive. Nowadays, some insurance plans may cover your treatment. That's what I tell the patients. You really have to do your homework. It's not my plan, it's your plan. You got to go pencil and paper. I have nothing to do with it. I don't control it. You have to understand your plan. Your plan will cover treatment. Your plan says it will not cover medication. Or it says we will cover medicine A, but we won't cover B, C, D. Now you definitely need A, B, C, D. So now you have to go buy B, C, D on your own. I can point out some pharmacy companies that I know that may have lower prices, but I still encourage my patients, do your own homework, shop around, shop prices. I have no control over this.
You mentioned that in Europe, the medication prices are about a tenth of what they are here in some cases.
Some medications are much cheaper, way much. Or even in the Middle East countries, a little different because their government subsidizes some. But certainly you go Asia, Africa, Europe, some of these medications are much, much cheaper. I mean, I used to have patients who would buy their medications from Israel for a third of the price, a third of the same medication. It comes from the same corporation, the same name. I'm not even talking the generic. Now, it would be nice if it was the generic. So all hope is not lost. We have a feeling.
At least we know it can be done better. Are there other ways that it's being done better in other first world or more civilized countries?
I don't really know the medical system, say in London or France. So I'm not a good person to answer that question. But I do know they have medications that are more cheaper. Where they get it from, I have no idea. One of the saving grace, I think a bunch of us have been trying to appeal to Mark Cuban. I know I sent several messages on LinkedIn and all my colleagues, and I think they heard us because one of the medications we use now is now manufactured, or I don't know how they do it, whether they manufacture it or where they get it from, but now it's actually probably less than 20% of the actual price, the same medication. So definitely when my patients need it, I always tell them, go to Matt Cuban's pharmacy is called Cost Plus. They can get these medications from there. There are some coupons, the same manufacturer's coupon, and you can get some of these medications for a fraction of the cost if you use the coupon. So the first thing I tell patients, go directly to the manufacturer's website, the medications website. On there, you may see what is called a manufacturer's coupon. Now, the coupon doesn't always work for everything, but when it does work, you would be shocked that you get such a deep discount. So look at the manufacturer's coupon, go to Matt Cuban's website, run your medication in, see if they have it. And then I just found out from one of my patients who struggled to get her medications recently, the manufacturers also, it may be a coupon program. They have some sort of arrangement with specific pharmacies. So again, they're cutting out the middleman and they're able to offer a discounted price if you have to dispense it from this particular pharmacies that they have. So they're discount pharmacies, but some of them may require you to buy a certain minimum. So you could get it for a lower price, but you have to get a certain minimum for you to be able to get that price.
It's interesting to hear you say this. I know I take a medication that And my doctor always tells me where I can get it least expensive, which is helpful. And sometimes he'll know whether or not my insurance would cover it or which insurances cover it. Thanks for that information and that good advice. I'm thinking there may be folks watching who are simply interested in reproductive health. And I know I certainly have family members and friends who have had IVF and have wonderful little babies now. So often a happy story. I'm wondering, just going back to some of the other things that you do professionally, is there anything that we need to be looking out for if we want to support our reproductive health? Are there environmental things we need to be aware of?
Oh gosh, yes. You can make this journey a little easier on yourself sometimes. Sometimes you can't help it. But where we can intervene, I always tell patients, try to intervene in the little small ways. For instance, we know that environmental factors can affect our fertility, and they do that by a number of ways, some of which they're called endocrine disrupting chemicals. Everybody's heard about them. What they do is they mimic your actual hormone, but they cannot do the correct task. So they sit on the receptor, interfere with the work of that hormone while not able to do the full task. So then you disrupt your reproductive cascade because we know your hormone signals is very intricate. I always liken it to an orchestra. It's a symphony. It's going from your brain to your pituitary gland, to your ovaries, to your testes, and it's all a nice synchrony until somebody screeches the album right in there, and it's going. You go, oh my gosh! You know when you're listening to nice classical music, and it's like a cat scratched the tape.
Yeah.
You can, that's exactly what you're doing when you take some of these chemicals that can interfere. So, little things, what are you exposing your body to? Little things like trying to avoid microplastics, and that's just plastics that leaches into food if you eat hot beverages in your food. We don't know what dose causes the harmful effect, how much of it becomes bad, but these chemicals could act in an endocrine disrupting way. And then you have even products that you use in your makeup or your deodorant or your lotion that you put on your face. And now we know some chemicals, not all, that you use in your nail varnish can be absorbed into your system. And
Wow.
they might do, again, what dose causes harm? I don't think we've done a full dose study, but it may cause potential issues. Then you look at things like smoking, excessive use of alcohol, and now we're even suspecting cannabinoids like marijuana. Those things can affect directly. They can disrupt. Remember that cat scratch on the album that I talked about? They can cause that, and also in ways that we don't fully understand. And they can also cause inflammation in your body. So your body becomes like a low simmering hotbed of inflammation that can affect your ability to get pregnant. And when you do get pregnant, they can also affect the baby inside you. One of the things we worry about is things that can cross the placenta that may have the potential to latch on to the DNA in your baby or in the placenta. And the thought is these things could cause what we call epigenetic, meaning above the genes, changes. And some of these changes can pass down to the next generation. Think of it like you consume something that goes to your DNA and it flips the light switch off. It doesn't remove your DNA, but it can determine which DNA is read and which DNA is skipped. And then if you put the light switch off on certain DNA, that light switch off can be inherited. You can pass it on to your baby. So your baby is born with the light switch off. They have the DNA, but somebody's jammed the key, somebody's jammed the lock, and it's jammed shut.
Oh,
That's what
my.
epigenetic changes cause.
Do we know what those things are that can have that impact?
We know that the way your DNA is packed, everybody always sees the nice helix that you see on science programs, but it's more than the science helix, right? You can't really stretch your DNA out like that. So it's folded upon itself. I don't know if you knit. you see the knitting wool that's in a bundled up together. So you're bundled up, certain proteins help bundling it up, and then you have strings that are not bundled. And then when it comes to reading the DNA, so you can pass on the information, you have to loosen that and be able to read it. We now know that there are certain key events that may either prevent that being unbundled carefully. Think of it like you have a scroll and you're going to read the scroll. You have a scroll, you're going to read it. You have to first open the scroll up and then you're going to read the information in there. Well, if you can't read the scroll so tightly bound, what good is it, whatever information's in there? So those are the things that we notice are being changed, the changes in effect.
Wow.
The things you eat, even if you can keep your body in a healthy condition. And I do understand that it can be a challenge and people can have conditions through no fault of their own. But whatever you can do to help that situation or even understanding it, I'll give an example. If you have too much insulin, and that's why they say if you're diabetic, try to correct it before you have a child.
Mm.
And you have, or if you have PCOS, so you have too much insulin floating in your body because your body is not using it very well. So your pancreas, not knowing, keeps throwing out insulin. Why is it not working? Come on, insulin, get out there. Until of course it burns itself out, and you got a whole different problem. That's insulin dependent diabetes. But in the initial, it's going to try and put out all these insulin because it's not working. Hello, the glucose is still high, but the insulin signals where it should be read is not communicating. If you are pregnant and you have all these hormonal milieu going on, the extra insulin, we don't know full well the effect it could have on the placenta. We know that if you have too much insulin, it can raise your androgen levels. Again, if you're pregnant, too much androgens going to your baby will have consequences. So you have babies born from women who have uncontrolled or untreated PCOS tend to also have the same propensity to have PCOS as well. So, and it all comes from the environment that you're in, and you're creating that environment for your baby. And by the way, the men are not innocent too, right?
Yeah.
It's
Uh,
50-50.
that was my
So,
next question. Is it all about the
yeah,
women and the eggs, or are there
no,
things
not at
men can
all.
do?
No, what you do with your body affects your sperm.
Hmm.
Now, we're still understanding fully the effects that are being transmitted, but some changes, just like you can affect the eggs, some changes can be passed on in the sperm. Again, the epigenetic changes that we talked about. Some changes can cause DNA fragmentation, so the sperm is not as healthy as it should be. We know, as a matter of fact, that if you're not healthy, if you've had high blood pressure, and recently there was an article I was reading that shows if you have pre high blood pressure, not full blown yet, pre, we used to think, oh, you're okay, just don't eat as much salt. Even pre high blood pressure can affect fertility. So now they're saying make sure your blood pressure is corrected if you can. Things like sleep apnea, you're not sleeping well, those things can affect your brain. It affects the I call it the hypothalamus in your brain is the master conductor, the orchestra of all your reproductive system. If you don't sleep well, if your body is in a state of inflammation, if you have a state of constant stress, your bodies are washing cortisol, it affects the master conductor. So the signals that are supposed to go downstream to your pituitary, to your testis, to your ovary, again, it's like somebody derailing the track. What are the things you could do? The first thing to do is how healthy are you? I can't tell you how many people I've diagnosed with thyroid problems, or I've actually picked up that they were diabetic, or I've picked up that they have such high cholesterol level. And I'm thinking, you know what? I'm actually even worried about your cholesterol is so high, blood pressure is so high, your insulin resistance. I'm worried, you could have a cardiovascular event. Forget trying to get pregnant. I'm just trying to get you to where people have heart attacks. People have they throw a blood clot. I'm worried about you not trying to think Are you going to do any of this crazy stuff while we're in the process of trying to get you pregnant? So when I see someone who's not very healthy, especially when they didn't even recognize it, but I do a general screen and I pick it up, then I tell them, we need to work together with your primary care doctor because I need them to fix da 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 while we're still working up why you're not getting pregnant so that we can work as a team, not in an isolated silo. Me just look at your eggs and your ovaries, your primary care doctor just look at your heart and your lungs. It's the same body we're working with.
Well, and if you do become pregnant, you want to make sure that you're going to be around to take care of your
Thank
child.
you very much. Absolutely. Yes. You want to be around for your child. I have had, you hear horror stories, but I've also seen women who got very, very, very sick from an uncontrolled disease entity after they delivered. And then it becomes, wow, we wish we had known this. So I have a patient now that had a massive pulmonary embolus previously, and now she's trying to get pregnant. And she had one other issue. So we're going to try and get her eggs with, we have protocols to lower estrogen levels. But because her doctor now says, we're so worried about you being pregnant, we might really strongly advocate that you get a surrogate.
Right.
Right. So many things like that. And I've even picked up breast cancer, testicular cancer, just in the space of me working them up. And then I say, okay, we got to pause a little bit. We got to work with our other colleagues and see what we need to do. First, make sure you're healthy. And then after that, what do we do to preserve your fertility while you're battling this terrible disease? And we do that all the time. But
Wow.
it takes teamwork on the parts of all the doctors to get the best outcome for our patients.
People want to reach you or
Yeah.
see your podcast or get your book. How would people get in touch with you or get any of that information?
So if you go to doctor, spell doctor all the way out, dryemi.com, or you go to Montgomery Fertility Center, all one word, .com, you will find me.
Is there anything else before we wind up that you feel you really would like to say or get out there?
I always put a PSA out at the beginning towards the end of the year. I tell patients, okay, it's coming to that time when your pharmacy benefits are being chosen again. Please go read the fine print. You can sign up for insurance only at certain times of the year, and whatever decision you make, you're going to have to live with it till the next open season. So I always alert patients. I said, okay, open season is coming upon us. Please, everybody, get your pencil and paper out. This is when you need to take agency and educate yourself and get the best plan that works for you.
Oh, well, thank you so much. It
Thank you.
is a fascinating topic. And I now understand why I think the title of your book talks about being healthy forever. I don't remember. Tell me the name of your book again with the subtitle.
It's The Quest for Fertility. It's a science-guided path to reproductive health, lifelong health, quest for fertility.
That's wonderful. So the message isn't just about having babies, but it's about having quality and quantity of life.
Absolutely.
And
thank you so much.
Good luck in your mission, and I hope that we'll help it progress just a little bit further.
Thank you so much. I appreciate it.